Hello, and welcome. This week, we are diving into OMT and dentistry, how to make it profitable, practical, and powerful. A much longer name intended for this live. This live, we're supposed to be like, making a difference, making money, making it work, all sorts of that. But profitable, practical, and powerful just kind of rolls a lot better and smoothly off the tongue. And so I am excited to be here with you tonight. Please let me know if you can hear me, if you can see me. We have children in the house. We've had 6 children in the house all week, but it's slowing down our internet significantly. And so I don't know what's going on. If you can hear me, you can see me, just give me a hi, hello. I would appreciate that. And, that's going to let me know that you're able to hear. Well, I feel like I have a lag, so it might be lagging for you all. So what I'm going to do is I'm going to take myself off of the screen. That might help us to come across a little clearer, at least be able to see me clearer. Hear me clearer is what I mean. Okay. Can somebody give me a yay? Ooh, yay. Thank you. Okay, good. It's starting to work now. Awesome. Fantastic. Okay, so we're off screen, but I'm here with you. I support you, and we're going to move forward. Okay, so let's just keep this perfect well-oiled machine going. Okay, don't forget to subscribe if you're watching me on YouTube. You can also follow me if you're watching on LinkedIn. Turn on all the notifications, make sure you're getting them. Comment, like, share. This helps to keep the exposure going. Let me let you know, if you are new to oral myofunctional therapy, you might think you see it everywhere. Let me tell you that you don't. The content that you do see everywhere is exactly the same. The content that I've been bringing to you for almost 35 weeks now in a row, I keep coming live again and again and again with brand new content and brand new things to tell you. All of this stuff you won't find anywhere else. So if we're not liking, commenting, sharing, then the rest of the world is kind of left in the dark that there are better resources out there available for free without the paywall for getting something more than just, standard blah, blah, blah about myofunctional therapy. So if you're here with me tonight, most likely you are an enthusiast for oral myofunctional therapy. You're trying to figure out how you can make it profitable, powerful, and, make it work for what you're trying to do. And I think that happens a lot. We all get excited about it. I have tons of free guides. You think these live lectures are something? It's nothing. I have a blog that is immensely popular. I am very well SEO indexed. I've got a decent size following on social media. I have a lot of different free guides for dentists, guides for the public, low cost courses, guides for hygienists, low cost memberships. I've got all sorts of things, and everybody gets really excited about myofunctional therapy. But then we all hit this random wall where you're like, okay, how do I take all this information that I'm absorbing about this topic, about myofunctional therapy, and transform it into actually doing something? Because I'm so excited. I just want everybody to know about this. And I'm telling my doctors, and I'm telling my co-hygienists, or I'm telling the associates in the office, and you've got everybody going and ready for this myofunctional therapy thing, right? It looks really glitzy, really glammy, and when you get into the underbelly of it, you're going to be able to get started right off the bat. And the reality is that's typically not the case. Okay, so this would be us getting really excited, heading off. We're going to take a myofunctional therapy course. I'm going to be a myofunctional therapist. I'm going to leave the op. What I would really love for you to do is to get some of the data about how many people take these courses and leave the op, because most people are still in the op. Okay, but you get really excited and you're like, okay, this is what I'm going to do. and I'm going to implement it in the office, and this is going to be really smooth, relatively seamless, and I can't see what could possibly go wrong. Awesome. So now you're led down that traditional pathway. You may have asked online, which you really shouldn't do, but I'm just going to throw that out there. You may have asked online, hey, which course do you guys think I should take? Aside from doing your own separate research, please visit last week's Smart Start lecture if you are confused about how to get a better start in myofunctional therapy for free or little investment. Okay. All right. So you take a course, whatever course pops up on your news feed, because you've asked everybody, what course should I take? Great. 5 people said I should take this course. I'm going to take that course. You take that course. And while you're in that course, you may start practicing. You may start working with friends or family members. You might attempt to work with a coworker. It's probably best, though, that, you keep everything behind closed doors, because you still feel like a complete imposter. You're doing all of that, and you are essentially failing again and again and again until success, right? So you've taken this course, you're practicing with all these people, you're confused, like, I don't know what, because, we are very tactile. I say it all the time, we're very tactile. I cannot imagine any sort of healthcare role without a clinical involved in it. And then we tell people they can become myofunctional therapists, be absolutely proficient, and never have any hands-on. It is the wildest thing that goes on in this field, but you're going to wind up coming out of your course practicing and failing and falling on your face again and again and again until one day something clicks. Right. And that's what they'll tell you to do. All of these mentors and course instructors, they're going to say, you're supposed to practice. And then once you keep doing it and doing it and doing it, you'll get better, because that's what happens. Practice makes perfect, right? Okay. You'll struggle with case acceptance. You'll have difficulty translating all that free work that you've been doing for practice. How are you going to get people to actually sit in your chair? I've been talking to them. I'm so excited about it. And I keep telling people that where their tongue rests matters. And I'm giving them all this information, but nobody is taking me on, or I'm having difficulty getting people in my area to bite, or my doctor I thought was going to be super excited about it. I took the course and now they're not excited and I can't put it in the practice. Or I'm a practice owner and I've taken this course and I don't see how this would fit in profitably into my practice. So you're going to struggle with acceptance. You won't get the case acceptance that you want. And I'm telling you, there are people who've been doing this for years who still don't get the case acceptance that they want. Case acceptance is something you'll probably struggle with again and again and again. But then the few people who do say yes, you're going to do their intake. I don't know why there are so many courses teaching people to spend 2 to 3 hours on an intake. So I get it. While you're in the course, right? When I was in hygiene school, it took me 2 hours and 45 minutes multiple times to finish a simple prophy, right? Because I had people looking over my shoulder. I was learning as I was going. But you're not doing any of that when you're in a myofunctional therapy course. Most of these courses don't have any on-site or in-person education. And what is in person typically is in like a classroom environment. So you're really not getting the experience that you would. Like, it's not going to work for you in the same real world scenarios. There is one course that does offer that. We'll get to that at some point in time. But these lengthy intakes, when you're not really practicing with real people, it's kind of obnoxious. Like, you really look like you don't know what you're doing when you're spending 3 hours trying to figure out what's going on with somebody. We have very short attention spans in this day and time, and I can't tell you what could be possibly more mind-numbing than the idea of spending 3 hours on an intake. But anyway, you'll do that intake, then you'll spend time, hopefully, writing up a great report and individualized treatment plan. I hope you are not doing cookie cutter treatments. If you are, you're going to find yourself stuck on that practice and fail and fail and fail and fail for multiple people over multiple years. You have to be able to do it in a personalized way. Okay. So you'll do all this maybe for 6 months to a year. That is typically the ticking point where most people are like, I can't do this. I don't know what I got myself into or why I even thought that this was the way to go. And you'll either go one of two ways. You might say, I'm going to dive deeper and I'm going to keep trying and I'm just going to let it ride. you might just start to drop off and be like, look, I've invested thousands already into Lord knows what. I have this LLC. I don't even know what I'm doing with it. I haven't made any money from it. I, have a website up and nobody's looking at it, or I've been trying to do social media, but I can't do all this while I'm working full time in the op. So sometimes you might say no, but then others might be like, hey, maybe it's time to get certified. I don't know for what, because certification is not really a thing. It's kind of this made up product, but maybe you want to get certified. Okay. So then you're like, okay, I don't feel like I really know enough, or maybe I gave up too early. And then you sign up for another course, or you start reading more. You're like, I should have done more research. And then suddenly now you're in the Myo community here with me and you're learning more and more and more, even after you've taken your first class, because you're so confused. You have no idea what you're doing. How do you make this profitable, right? Some people quit trying and give up. Other people keep going to conferences and they're like, oh, somebody's speaking about it. Katrina's speaking about it at RDH Under One Roof. She's going to speak about airway. I got to go. I'm going to go learn more. And then that invigorates you again. And maybe you might sign up for mentorship. And this endless cycle will continue to go on and on and on till the end of time, because for some godforsaken reason, nobody seems to understand that you need to have a better foundation in what you're getting yourself into before you go into the field of myofunctional therapy. But if you've already gone down that route, that's okay. There's a lot of great options for you. Okay. Here's the problem though, is that when you take more courses, nobody pays you more for it. Okay. So if you took one course and that course was super comprehensive and you were able to come out and to practice, you're going to get paid the same amount of money as somebody who took 2 or 3 intro courses or supplementary courses or took bonus business training. You're going to get paid the same amount of money, because guess what? Your services are not worth more because you've spent more. When you're loose with your wallet, that doesn't mean that I now have to pay for it as the consumer. The services are worth what the services are worth, and there is a cap. Like, capitalism is a very finite art. You're not going to be successful by saying, hey, I've spent $15,000 on myofunctional therapy courses. I need people to pay me $8,000 for my services. Okay, based on what? I don't know, because it sounds like if you needed $15,000 just to get started, you might not know what you're doing. But that's neither here nor there. Here is the ultimate problem. More courses, you're not going to get more income. So you're spending more. You're feeling like, well, what the heck did I even do? All I wanted to do was just help people. That's all I wanted. And so this is why less than 1% of hygienists, less than 1% of speech language pathologists, less than 1% of dental offices are implementing myofunctional therapy, because nobody has it figured out. Nobody has it figured out. I don't care what anybody says. I don't care what the ADA is advocating for, what the ADHA is advocating for. These are not your regulatory bodies. These are not your dental boards, okay? Myo has nothing to do with dentistry. It also has nothing to do with speech. In most states in the United States of America, there are only 3 states I know of which it is written into the Practice Acts, and it's not even as oral facial myofunctional therapy. It is written as oral myofunctional disorders, which is totally different. It's not making it its own separate therapeutic process. It's really just talking about the dysfunction of the oral motor complex, okay? So here's where we have this issue here, where we have dental providers failing at a rate that's 3 times more than those who are in other professions. So the OTs, the RNs, the IBCLCs, the whoever else is taking it, they don't take it and try to make it its own separate thing. They take it and they add it on as a bonus to what they're already doing and working with patients. But we can't do that in dentistry. So OMT in dentistry has to look entirely different. And if you need a scope of practice review, I have that. There's a state of the field address that's also on my YouTube page. All right. And so these are things that we need to keep in mind, is that the process isn't simple. A lot more people are failing than those who are winning at it. I don't care what anybody tells you or how glitzy or glamorous they try to make it seem. It is something that you have to walk into lightly. Okay. I cannot put enough emphasis on that. So, how do you bridge the gap? How do you bridge the gap between all of this excitement and energy and getting to a place where, oh my gosh, this is working? This is something that I can actually do? Well, you have to do it smart. We're going to talk about that tonight. We've got 3 goals for you to be able to accomplish by the end of this talk. Okay. I want you to understand how you can make a difference in people's lives. Where does OMT fit in dentistry? And a lot of people might give you something really vague or like, oh, it's really great with ortho. Guess what? We've already done a lecture on how myo and ortho go together. But don't worry, you can always go back to that also another time. But it's not just ortho. It's not just airway. It's not just sleep. It goes with a lot of other things. And so we're going to get into that. We're going to dive into that actually first. Later, we're going to get into how it makes money, how you get it to be a profitable system, and how you make it work in the dental office. Like, what on earth are you supposed to do to get it to really logistically make sense in your practice? So let's start first with making a difference, okay? We know with all of our excitement about oral myofunctional therapy that it can help patients with a lot of different things. So airway, yes, but periodontal disease and parafunctional habits are very closely associated in the same way that airway-centered disorders and sleep disordered breathing is very closely associated, right? Periodontal disease, we talk about all the time biochemical influences that do make an impact on the periodontium and the health of the periodontium. But a lot of times we don't talk about these biomechanical influences that are actually creating a destructive process. That's the word I was looking for. Destructive process on the periodontium. So parafunctional habits such as bruxing, grinding, we know that the body responds to loading. And when we're talking about loading, you're clenching, you're grinding, you're putting 70 to 80 pounds per square inch of pressure on these bones and the periodontal ligament space. That periodontal ligament space is built to withstand it, right? So our teeth are not firmly embedded just straight in the bone. There is that space for it to move up and down, right? But when there's too much force applied, excess force, what happens? The osteoclasts are brought in, right? And the osteoclasts start breaking down. And so we'll see vertical bony defects, which are creating extra space. And now we've got opportunistic bacteria that's able to live in that space. And now we've got periodontal disease on a whole nother dimension that I don't care how much they're brushing, they're flossing, they can be coming in every 3 days for a perio maintenance. You're not going to be able to stabilize them without eliminating that parafunctional habit, right? So our periodontal disease that's chronic in lieu of exceptional is going to be what I call that exceptional oral hygiene. When you have people who are highly compliant and you can't figure out why we're not able to stabilize their chronic periodontal disease and the progression of such, most likely we need to start looking into their parafunctional habits. So there we go for all of our general dentistry, right? That's absolutely wonderful. TMD, we all start looking for splints, or we're looking at the newest dental specialty, the sparkling shine of dentistry, our our oral pain specialists. These oral pain specialists, they are phenomenal at helping them get out of pain. But guess what? We did do a TMJ lecture. And what did we learn in there? That it's the retractive forces that are placed on the mandible that are going to impact that temporomandibular joint. And that's going to create a lot of friction that can displace. So now we'll have displacement with the clicking and the popping and more of that, and or we'll have pain that's associated with overcompensation in the musculature around the TMJ, right? So around that joint, we're creating this habit that is building and building and building and creating a negative pattern that, yes, our splint can help with our occlusion and help to offset it. But where do we get that new pseudo disc from? Well, the pseudo disc comes from new behaviors and learned movement patterns so that they're not dependent on that splint the rest of their life. We don't want somebody who has a parafunctional habit of bruxism that is contributing to their TMD to have to wear a night guard every single night for the rest of their lives. We're root cause specialists, right? We want to get down to the root. If we didn't want to get down to the root, there would be no preventative dentistry. So preventative dentistry and myofunctional therapy actually go very well hand in hand, okay? Mouth breathing, sleep disordered breathing, those go together really well. Digestive disorders. Oh, I can't tell you how much the mouth breathing and the digestive disorders go together. I should probably do my next live stream on that. That would be a very interesting talk for us to all go over. But when we change our mechanism of breathing, that's going to change how our body is responding. That's going to change the pH of our saliva. That's going to now alter what lives in the mouth. And that goes straight down. Yes, when we eat, we're swallowing saliva, and guess where that goes? Now we're introducing new bacteria into the oral, from the oral microbiome into the gut microbiome. And now we're creating all this change. Sometimes it creates inflammation, this new bacteria, and then that is going to lead us to potentially leaky gut syndrome, right? So we see people who have leaky gut, and we see people who have issues with constipation or diarrhea and so forth. A lot of that sometimes is very well associated with what's going on in the oral cavity and the saliva and the contents of such. So it's incredibly helpful and can help patients with a lot of different things. But I want to focus on two specific things that I don't see enough people talking about and that are incredibly important. I'm going to be in Kentucky later on this month. Well, it's not officially August yet, but it'll be August very soon. August 23rd, I believe I'm speaking at the Kentucky Dental Association about how myofunctional therapy fits in with various dental specialties. Now, it's a 3-hour lecture. So for 3 hours, you know how much research I've had to do? I am thrilled to talk to you about some of this stuff and give you kind of a little peek into what I'm talking about. I will also be in Fort Lauderdale, November 8th and 9th for the Nearman Practice Management Dental Sleep Symposium. And so it's Dental Sleep Medicine Symposium. I think that's what it's called. Don't, hold me to that, but that's what it's called. It's in Fort Lauderdale. Okay. It's in Fort Lauderdale. I'm speaking about dental sleep medicine. So I want to talk to you about dental sleep medicine for a second. If you're not familiar with a mandibular advancement device or oral appliances that are used to help with sleep apnea and so forth, they have a certain mechanism of action where they are going to pull forward and hold forward the mandible. Now, what does this mean for us as myofunctional therapists? Well, it actually means a lot because this is going to now create some tension on our suprahyoid and the veropharyngeal space. Okay. Now, while we have some imaging and there has been some technology and research done that is giving us different ways and techniques to really quantify what's happening, most of these studies lack true kinematic linkages. So we're not entirely sure how it's really impacting the musculature because we can only see from a 2 or 3D lens, but we're really looking at a multidimensional person and a multidimensional space. And so it's very difficult to really study it in real time. But essentially what's going to happen, the biggest impact and influence that's happening for us as therapists is that we need to be there because when they're working with a mandibular advancement device, yes, it is opening up the airway. And I'll show you with this video in just a second how it's doing that. But while it is creating that tension on the suprahyoid, okay, that muscle and the veropharyngeal space is all that space where we need that oral phase swallow, okay, it's elongating the tongue. So we've got the inferior portion of the tongue being pulled and elongated along the way. So it's not really helping to, and I hate the word tone, but it's not really helping to strengthen or build tone in the genioglossus. It's just displacing it, right? So where we come in, you'll see in just a second. I want you to see the mandibular advancement device in action and to see what it is that I was just referencing. And then we'll talk about how we come into play.
A sleeve appliance is a device that is worn in the mouth overnight, designed to position the lower jaw slightly forward, thereby bringing the tongue forward and expanding the throat in a way that keeps your airway open to facilitate unobstructed breathing while you are asleep. There are several designs and styles of sleep appliances.
Okay, we're going to leave that at that, okay? Just wanted you to see how it moves. That way you know. So where does myofunctional therapy play into there? Well, you can make a difference when you're working with dental sleep medicine practices by supporting the corticomotor control because they lose a lot of that. They wind up losing some of their corticomotor control, so their ability, brain to body, awareness and motor control, their skills, they lose some of that while they're in these appliances. And the research is there to back that up, right? And so we're going to be there to help maintain that and give them all the tools that they can really use daily to maintain that and strengthen the velopharyngeal and lingual musculature. So we're going to be able to be there to support everything that's kind of being unwound while they're in mandibular advancement devices. Now, just like with a mandibular advancement device, in the morning, there is a deprogrammer, and they're going to then put in that deprogrammer to put back their occlusion and to get that mandible to sit back where it's supposed to sit. It's undoing in its own way the effects of what it does, right? But we're not doing anything as a field most times to help support the soft tissues that are around there. And so it's incredibly important, and I'll be talking about this on the main stage at the Dental Sleep Medicine Symposium in Fort Lauderdale, November 8th and 9th. Please join me down there. It's going to be a phenomenal conference, and I'm so excited that finally dentistry is starting to really listen. Dental sleep medicine, I should say, is starting to really listen to the importance of myofunctional therapy on having optimal patient outcomes and them being able to support and sustain wearing long-term these devices. Okay, so it is not about any one thing. Dental sleep medicine is not better than oral myofunctional therapy, and oral myofunctional therapy is not better than dental sleep medicine appliances and techniques. It's about working together so you can make a difference there. Okay, there's not a lot of people or anybody I know, honestly, talking about this stuff. So it's incredibly important that we talk about this. Secondarily, oral maxillofacial surgery. If you're not collaborating as a myofunctional therapist with an oral maxillofacial surgeon, you are missing out on some wonderful stuff. It is absolutely important that we collaborate because there are pre-surgical goals that we can be a part of, particularly if you're working with certain genetic syndromes and so forth. And I have a good portion of that in my myopathway course, but that's neither here nor there. There are a lot of great implications where you can start working on negative habits that contributed to them needing the surgery. And then afterwards, you can help them recover optimally from the surgery. So let's look at what a maxillomandibular advancement surgery, MMA surgery, looks like and what that does. Narrow airway here. That's snoring. They're going to surgically incise those areas, those dotted lines, advance it forward manually, sorry. And then they're going to reinforce the new position. And now Able to breathe freely, okay? It's not as wonderful a dramatic difference if you don't hear the breathing, but ideally, breathing is meant to be inaudible. So you want to not hear the breathing, okay? So with oral maxillofacial surgery, you can make a difference for people by having their back before surgery and supporting them after surgery by restoring motion, strength, habits, good positive habits. So now we're going to remediate any of those bad habits and normal oral and masticatory function. But if you're not working with oral maxillofacial surgeons, you're missing out on a good wealth of people who really do need the support, because afterwards they struggle a lot. So they might see PTs, and there are some phenomenal PTs. I know many PTs I've gotten to know now, and the scope of PT is not what you think it is. It's not like all PTs do the same thing. There are some that go intraoral. There are some who specialize in this thing, some who specialize in another thing. It is absolutely vast how many things they can really specialize in. Pelvic floor, like you need a pelvic floor PT. There are so many ways that oral myofunctional therapy really helps to make a difference on a bunch of different things. But for dentistry specifically, okay, I've given you a couple of different ways that you can make a difference. So yes, that's wonderful. Okay, Carice, I get it. I can make a difference, and I can work with various types of specialties, and I can do a lot of things that I didn't think that I could do and be a part of outside of the traditional airway sleep conversations, right? So let's go on to make money. You got it. You can make a difference. How does it make money? This is the important part. Systems. Systems are the only way that you're going to be able to make money and make it profitable. This is how you make it work in a dental practice. It will not work any other way. You have to have a system. Now, you already have a system. How do you integrate oral myofunctional therapy into that system? That is the big thing, okay? That's where we're going to find the difference. You might hear children in the background. I apologize. It's like this large sleepover. Okay, so education first and foremost. One, for the entire team. That way, you can start to implement these conversations into your patient education. But two, because it's just so incredibly important that everybody knows, I cannot imagine, and I've done this before, I've had this before, where I've had to explain to the front desk multiple times how they could talk about myofunctional therapy. I can't imagine being in a dental office, being told by the doctor that I need a root canal, and then I go up to the front and I'm like, I'm sorry, I blacked out. Like, I feel like he told me I needed a root canal. What's a root canal? And then the front lady looks at me and is like, I don't know. It's that thing when I'm gonna get the doctor for you. Oh wow. I feel significantly less confident with the ability of this office to really do that procedure. Now I might go see an endodontist. Like, I'm like, I don't know, I don't want to do this here. If I'm going to do it at all, I want to be somewhere where everybody kind of understands what's going on and somebody can explain it to me in a way that will ease my worries and my concerns, because that's a big thing. A lot of people who step foot into a dental office are already on high alert. They feel very anxious. They're very much like, oh my goodness, I don't know what's going to happen. There are certain people who feel like, the doctor's just out to get them, is just trying to find work to do, even if they feel like their teeth don't hurt or whatever. You have an uphill battle. Why make it any more difficult by now having some new service that comes in and nobody in the office is able to explain it to people? What? This is absurd. You have to be able to explain it, right? So it's essential. And once you get yourself super educated, it's really important to start having those talks and that conversation with the team and really getting them on board with everything too, okay? getting them on board with everything too. So you can all go to courses together. You can take a full course together. That's been getting a lot of people in trouble because then people think that they know myofunctional therapy or they start calling themselves myofunctional therapists. And we don't want the office manager to feel like they are a myofunctional therapist. So why did you let them into the full myofunctional therapy course? I don't know. We're confused. But what you really need to do is participate in free lectures that are going to give you a great overview of all the basics. So whether it's one of the things that are available here on my YouTube channel, on my LinkedIn, or in the Myo community on Facebook, whether it is downloading one of those free guides I talked about before and really having people dive in, whether it's investing in books or, reading a lot of research and giving people information, you have to make sure that everybody is educated, because in order for your systems to work, it's got to be a thing where everybody understands, because as they pass hands, which dental patients always do, pass hands from whoever greets them at the front to the back end of the office to back to the front end of the office. Maybe there's a treatment coordinator and they're passing hands there again too. Every step of the way, people should be able to explain everything, all of the procedures that are options at that practice. Okay, myofunctional therapy is no different. So then you've got to map your flow. How is this going to fit in with our current workflow? How do we make a system where we're going to be able to get it to happen? And when you're talking about implementing myofunctional therapy as like, okay, you're going to have a practitioner in your office, awesome. Is that practitioner going to be separate, or is that practitioner going to be the hygienist? If it's the hygienist, well, you've got their whole appointment that potentially they can do some screenings, assessments, education, and then the dentist comes in and is going to give the recare exam. Awesome. Recare exam. Love it. You look great, Susan. And now I totally agree with what Jane said as far as you needing myofunctional therapy. Here's the reasons why. This is what it could really help with. Your periodontal case has not gotten much stability. I think it's the parafunctional habits. And Jane is going to be wonderful at working with you to eliminate those through an exercise-based program called myofunctional therapy. And I'll leave it to her to tell you the rest. It was great seeing you, Susan. Gotta go. Bye. Gone. Oh, what was all that? Now Susan's looking at Jane, and Jane is going to now explain. So now Jane RDH is explaining, and then we'll confirm or transfer this person now back to the front. Perhaps that's where they'll get scheduled. Or it might be that, there is a assessment or evaluation, or maybe the recare exam is happening first. And then that's going to be the dentist who is going to be prescribing, hey, the myofunctional therapy, I think, is the thing. And then Jane comes in, and Jane is the explainer during the recare assessment and prophy, and is going to go through and really dive into it, and then is going to schedule it herself. And then maybe at the front, they take payment and so forth. You're going to have to figure out how you're going to map your flow and how it's going to fit in with what you currently do. Because if you can't fit it into your current flow, it's not going to make you money. Okay, you want to make money, it's got to fit into the flow. If you are doing it in office, it has to be a systemized thing. And you have to understand that the only thing that I can absolutely guarantee you is that you're going to change that workflow. You may change it 3 to 5 times before you find your sweet spot, meaning that you're slowing yourself down from some of the money that you can make. Now, I don't want to be confusing in any way, shape, or form. I told you I would show you how to make money. I am the $1 million myo lady. Like, I can show you how to make $250,000 easy with myofunctional therapy in the dental practice, but you have to do it smart. Here's where people commonly slipped up. Okay, this is the common path of income. You'll have $1,500 to $2,500 being the typical range of full myofunctional therapy programs. That is not you doing an abbreviated, like, oh, we're going to do some tongue tie release exercises before and after, and then you're on your merry way. This is a full, we are committed for 6 to 12 months of myofunctional therapy, and this is the fee. So let's make this the average across the US, $1,500 to $2,500. Great. Sounds like great money, especially if, let's say, you're seeing 8 patients a day in the hygiene schedule, if you have an hour for each, and you might be seeing an additional 10 in the dental schedule. And so that is 18 opportunities a day. And if you have 18 opportunities a day and you can close 3 to 4 of those full myofunctional therapy programs a week, and I would love for anybody who's doing that to write something in my comments now and be like, yeah, that's exactly what we're doing. I guarantee you're going to struggle to find people who are doing it this way and getting 3 to 4 a week, committing, okay? Even in big name cities like New York City, Los Angeles, Beverly Hills, and so forth. It's very difficult to come by because there's such a hurdle of education, and a lot of people come at case acceptance and trying to explain it to patients the wrong way. Nobody cares about proper oral rest posture. You care about it. Literally no one else does. I will never spend $2,000 for proper oral rest posture. So 3 to 4 a week of your case acceptance. Let's assume for the sake of math that you're doing that, okay? That is $4,500 a week of revenue. So you're bringing in, that's your income for myofunctional therapy for the practice, okay? Absolutely wonderful. Let's multiply that by 52 weeks. Let's say we're working all 52 weeks. That is going to be your annual income that comes in from myofunctional therapy. Now, these are not all profits. This is just what's coming in. But then once we get supplies and our systems and or software, and we get whatever we're spending on our billing and yada, 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 once we get all that out of the way, you still have a good 6 figures of additional practice revenue, which is wonderful if you're doing it the common way. The common way, I don't know too many people who are actually making this amount of money. There is a very small window of people making this amount of money in this way because it's a hardball sell. It's a really hardball sell, especially at these numbers for something that people can't really describe to you. Myofunctional therapy, like I've never wanted that ever in my life. If I've thought about having like a motorcycle and somebody comes along and they're like, hey, this motorcycle is $20,000, well, then I'm not thinking really 2 or 3 times about that. I might find a way to make that happen. But when it's something that I have no idea what it is, I could give or take it because so far, as long as I've been alive, I've been fine without it, right? And I didn't know what it was. Maybe I'll still be fine without it. So there's a more of an uncommon path of income. And if you're going to get real true success, you have to abbreviate these myofunctional therapy programs. Now, if you missed the evidence versus hype lecture that I did where we talked about what the research behind myofunctional therapy is. You can't see me, but I definitely put that in quotes. You're going to see that most of the research goes back to doing a handful of exercises or 2 handfuls. 7 to 10 is typically the average set of exercises for 2 to 3, sometimes 4 months. And then they call it. That's it. That's your myofunctional therapy program. And then the research, and we're all quoting that as if that's like what we all practice in. And that is not what myofunctional therapy is taught as or practiced as. It's practiced as this lengthy, personalized thing where you can't possibly put research to it because no 2 people are doing it the same. It looks vastly different for everybody, but all the research that everybody is quoting is done extremely differently. We have shortened education, shortened resources, shortened windows. So when you provide shortened abbreviated programs, guess what you can charge? less. And when you're able to charge less, you're able to bring up acceptance because it's easier for you and it's easier for you to implement, and you can actually see this amount of people. Because in that last example, when we look at those numbers, if you're getting 3 to 4 new ones a week and you're able to work with all of them, your caseload is full by the time you've hit two months. I give you 2 months tops of like every week 3 to 4 people, and then you've got to work with those people for anywhere from 6 to 12 months. You don't have space in your schedule to start seeing other people. Now you've got a wait list, and then that wait list, you can't take money from people who are just sitting on your wait list. You got to wait for that. Like, so a lot of times it doesn't work out that way. It works out significantly better when you abbreviate and shorten the treatment plans, right? But you still need systems that are going to be custom to your practice. So you still need a way to explain it and still need a way to really guide it and make sure that you are proficient in doing it. And then you're going to need proficiency in like actually delivering these outcomes, clinical proficiency. So can you make money with Myo? Absolutely. I think you have to do it smartly. If you're doing it in a dental practice, in abbreviated systems is absolutely the best way to do it if you're doing it with an independent practitioner who's in your office. I've got an even better way for you in just a second, okay? So let's say you are sitting and you're like, ooh, well, I wonder how I could do this, or I wonder what I might be able to do or utilize in order to make this happen for myself and my practice. I would love to bring this up to my doc. Awesome. If you are interested in bringing it up to your doctor, you want to bring it up as a partnership. You want to partner with them for the growth of the practice, and you are going to bring in an additional $250,000 of practice revenue. If you have multiple hygienists, I'm telling you, so easy. I love the consulting that I've been doing lately. You can get upwards of $1 million of revenue with multiple chairs actively doing abbreviated Myo. Okay, so let's say you want to go and you want to get the education, and you're like, hey doc, this course costs $2,500, $3,000, $3,500, whatever the course price is. It costs this much. If you invest in it, I will do all the work. I will make sure that we are getting it implemented. I'm going to sign up for the course that's going to do on-site mentorship, and we'll have the instructor come here and show us how to put it in person in the practice. That would be the smartest choice, actually, to convey to the doctor. But you're going to do that, and you're going to do that in a way that is going to advance, you'll be able to skip ahead. So you're going to advance your success, and you will be able to implement. And so that first 2,500, 3,000, 3,500, whatever you're spending on your first course, so that first course, you get back that money right away before we ever start talking splitting of profits. Now, once it's time to split profits, 30 to 40% is the industry average. I'll tell you that it's very hard to scale. It is very hard to make a business out of something if you're trying to split like 50-50 product profits when there is an unequal distribution in the vested parts of the business, like the parts of the business where we have to pay for the supplies and the building and the space and the marketing and so forth. When we're paying for all of that, it's very difficult to scale. So 30 to 40% is the typical split. 30% for you if you are doing this as an abbreviated program part-time in the dental practice. So you're still making income and wages. That's an additional on top of what you're already making, an additional $75,000 for you, and an additional $175,000 for the dentist and the practice. And that practice has done nothing for those fees. It's all been you doing abbreviated programs for multitudes of people in a systemized way that is very easy to implement. Okay, easy. You can make money with myofunctional therapy in dentistry. You have to be smart about it. Don't jump for the first thing smoking. You're going to find yourself in a pit. Okay, so final step. How do we make it work in the office? Five things. 5 things and 5 things only. You have to understand, ideally, comprehend comprehensively by the end of whatever course you take how to work with your ideal patient. What is your ideal patient? If you are in a pediatric practice and most of your patients are going to be pediatrics and you need to do abbreviated pediatric program, I would ask if that is even a possibility at some of these courses before I go signing up for the first thing that somebody online told me was a great course. Like, I'm going to start interviewing and asking people what's going on. Can I understand comprehensively how to work with dental sleep medicine cases? Do I understand comprehensively at the end of this course how to work with those cases? I do not care how to work with tongue ties. I do not intend to work with tongue ties. My practitioner does not do tongue tie releases. My practitioner does dental sleep medicine, and I need to know comprehensively how do I work with that patient. Is that something that your course teaches? Period. If you take the wrong course and you wind up with like a little blip of information about how you work with somebody, or they tell you, oh, there's no difference in working with this and that, it's very obvious that they do not even understand the field of which they're teaching in. There is a lot of difference to a lot of different factors. Like, if you have to help somebody have all the tools to keep reworking their corticomotor skills, what are their daily efforts going to be in these myofunctional therapy programs? Will it be progressive, or will it be something that's really going to help to sustain them? Like, if you cannot get complex answers, this is not the course for you to take, okay? You cannot make it work if you do not comprehensively understand what it is you're supposed to do to work with your ideal patient. Then you need to understand how to convey that effectively. It's sales. I don't care how you feel about the word sales. We're all selling things every single day. With myofunctional therapy, there's not one day, and I wish sometimes there were, but there's not one day in my life where I do not have to explain to somebody what myofunctional therapy is. Even if I'm on vacation and somebody I happen to spark a conversation with is like, what do you do? Oh, I'm a myofunctional therapist. Guess what? Now that comes with a whole nother conversation where I have to explain that to them. And then I'm going to hear about their cousin Sue or their brother Joe who chews with their mouth open and they think they need myofunctional therapy. Like, it winds up to become a whole thing. Okay. It's always a pitch every single time. How do you convey effectively? Effectively is judging by how many times you're able to convert for your case acceptance. How are you able to convey your work to somebody else? And how many of those people are grabbing on? You have to understand how to maintain scope. If I didn't say this loud enough, sharp enough, or clear enough for you at the last week when I talked about the Smart Start, when that dental board comes a knocking, knock, 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 and they're like, hey, what are you doing? You're doing myofunctional therapy and you're doing it in a dental practice. I want all of your records. And if all of your records are combined with your dental records, you're going to be in some issues, okay? You have to keep everything separate. You have to understand how to maintain, and scope is in quotes for a very specific reason. You are not a dental practitioner while you are doing myofunctional therapy. You are just an independent practitioner. You are off the clock as a hygienist, off the clock as anything in dentistry when you are doing myofunctional therapy. You need to understand scope. If you don't understand it, you're going to wind up like most of the people who the 3 times over are losing their investment in spending thousands for these courses and having no idea how to protect themselves or their licensure. If anybody has to choose, I would never, ever, ever in my life choose oral myofunctional therapy over that license that I spent years of traumatic instances trying to obtain. Okay, it's been a traumatic experience. I'm licensed in 2 states. I will continue for the rest of my life, whether that's an inactive or active license, but I will continue to be licensed. Okay, I'm never going to stop that. So don't put your license or your livelihood at risk. Understand how to maintain scope. Understand how to deliver outcomes, because if you don't even understand how to work with your ideal patient, you're certainly not going to be able to deliver on your promises. And I'm going to assure you that the first 1 to 2 people that you make mad because you've charged them XYZ amount of money and they haven't gotten any results, or they're not getting the outcomes that you promised, you've been talking about, oh, how we can help cure your sleep apnea or all this other inaccuracies, that's going to be a problem. It's going to be a problem. Your career will be very short lived, and you might get that board call a little bit sooner than you would have liked. Okay. You have to understand how to deliver the outcomes, how to really proficiently work in this field, and then how to do all of that within a dental practice. Like, how do you actually effectively make it move and make it smooth? That's going to be the key if you are an individual just trying to put it into the practice. But if you're not an individual trying to put it into the practice and you're like, or even if you are, and you're like, I can't do this. So, well, you can do it, but you can do it in a way that is a bit distanced. Okay. And I'll tell you, for those of you who are unfamiliar with Spur Dental is my wonderful baby that has been growing. And recently I am trying to put together some job, postings and so forth, because I need more people. I need more people who comprehensively understand how to do abbreviated myofunctional therapy programs to help me with Spur. I need more employees. So Spur Dental is the ideal way to put myofunctional therapy profitably into your practice and powerfully into your dental practice. Why is that? Because you do nothing. You are hands off, entirely hands off. So with Spur Dental, it's the practice as a member of the program. So the practice is a member, and you get to refer as many patients as you want. You give them your unique practice code. They come, they log on to our website, they put in the code into their intake form, they schedule right away with a therapist. We put them one-on-one. We select based on whatever criteria. We put them with a specific therapist. And then from there, they're doing one-on-ones, and the practice is updated through shared sheets. So we have practice sheets, Google Sheets that we use for each practice. And the therapist is updating it with, okay, with your patients. This is a phenomenal way for you to be able to integrate and get the effects of myofunctional therapy, but you do nothing for it. You don't even have the patients pay for it. You're a part of the membership, so you've paid. They pay nothing when they come to Spur. So it's one fee that you pay for the year, or there is a monthly fee if you're going to be a monthly member, but most members are members for the year. You pay an annual fee, and then your patients come and there's no barriers. They don't have to say, oh, well, how much is it? Don't worry. I got it. I'm taking care of you, Susan. I've already paid for the membership for you. You go and you're going to work with them, and it's not going to cost you a thing. I want you to work on your parafunctional habits. I want you to work on the TMJ. I want you to work on whatever. And then our coaches are able to do the one-on-ones, and we're gearing and going for those goals, and we're supporting them. So we are doing all of the work. It is a phenomenal way for you to integrate it without having to add on to your practice. If everything I said before was like, wow, that's a lot of work, it sounds like a lot of stress, it sounds like a lot of money, I want nothing to do with it, Spur Dental is exactly where you want to be. And if Spur Dental sounds great to you and you're a myofunctional therapist, like, hit me up, because I'm still working on my job board postings and like trying to word it just right so that I get the right candidates. I am very, very selective with who is going to be working for Spur, because results and value is my big thing. I need people to come through with big, valuable contributions to the organization. So I would love to chat with you if you're interested in Spur for yourself, for working in your practice, or if you're interested in working for Spur as a therapist. We would love to have new coaches. We're very, very excited about all the growth that's been going on with Spur. But let's chat. We could chat about absolutely anything. If you think that you want to take on the burden of myofunctional therapy, absolutely. MyoPathway is the best way to get started. It is the only way that has a full on-site mentorship option. And I don't know anybody else that's flying out to you included in the price of the course than with MyoPathway. So MyoPathway is ideal. And so let's chat. I've loved being here with you this evening. I look forward to seeing you next week where we talk about something else powerful and wonderful in the field of myofunctional therapy. But for now, I bid you good night.